Let's get this party started with Part D. No, not vitamin D, though you might need that too. I'm talking about Medicare Part D, the one that helps folks like you and me pay for prescription drugs. It covers things like insulin, shots, and fancy meds I can't even pronounce. But listen close now. This isn't run by Uncle Sam directly. Nope, private insurance companies run these plans. They just gotta follow Medicare's rules. You can get your drug coverage through a standalone prescription drug plan or a Medicare Advantage plan that includes drug coverage. You hear folks say MAPD? That's what they mean. And don't forget, PACE. And some cost plans might offer drug coverage too, but that's more advanced than my pressure cooker, so we'll leave that alone for now. Now, if someone's got Part A and or Part B and lives in the service area, they can enroll. But tell them they need to sign up when they're first eligible, or they might get hit with a late enrollment penalty. And baby, that thing sticks around longer than a casserole dish at a church potluck. What's covered and what ain't? Let's talk drugs. Prescription drugs, honey. Part D covers prescription medications, insulin and all the little doohickeys that help you inject it, vaccines like shingles and whooping cough, some biologics and specialty meds. But here's what it won't cover. Anything over the counter, unless a plan goes above and beyond. Hair growth pills, yep, bald is still beautiful. ED meds, unless it's for certain medical conditions. Each plan has a formulary, a fancy word for a drug list. These drugs are split into tiers. Tier 1 is generic, cheap as a cup of diner coffee. Tier 2 is preferred brand. Tier 3 is non-preferred brand. Tier 4 is the high-end, need a coupon kind. Plans got to cover drugs in certain classes like anti-cancer or HIV meds. And if a plan changes its formulary, they better send notice at least 30 days before. The cost breakdown, hold on to your wig. All right, baby, let's talk about what really matters, money. If your client's got prescription drugs, they better know how these costs add up over time. In 2026, there's no more coverage gap. Hallelujah. Just 3 phases that every agent and their granny should know. Let's break it down nice and easy. 1, deductible period. This is the part where the plan says, you go first, sugar. Until you hit your deductible, you pay the full negotiated price for your prescriptions. Some plans don't have a deductible, but if they do, it can't be more than $650 in 2026. So remember, you pay 100% until you meet the deductible. After that, your plan starts to chip in. 2, initial coverage period. Now we're cooking. Once you meet your deductible, your plan covers part of the cost. You'll usually pay a copay or coinsurance, and the plan covers the rest. This phase lasts until your total drug costs hit $2,100. That number includes what you paid toward the deductible and copays, what your plan paid, help from family, charities, or extra help. Some state programs, SPAPs, Indian Health Services, and even AIDS drug assistance programs. Even a little help from enhanced Part D plans or your job-based insurance might count. All that adds up to $2,100. Once you cross that line, baby, you've made it. 3, catastrophic coverage. This is the part where Medicare says, you've done enough, sit down and rest. When your out-of-pocket costs hit $2,100 in 2026, you enter the catastrophic phase, and guess what? You pay $0 for your covered drugs after that. Yes, indeed, $0. The plan tracks your spending and should show it on your monthly statement, just like my bridge club keeps track of who owes who pie money. Important note, plans can change drug prices during the year, but they must tell the beneficiary in writing. However, they cannot change your deductible or premium mid-year. Those are locked in tighter than my church hat on Easter Sunday. Premiums, penalties, and payment plans. Oh my! Now don't you dare skip this part. People get all surprised when they get slapped with a penalty, and I say, child, you better read the fine print. Part D plans charge monthly premiums. That amount varies depending on the plan. Folks can pay by check, bank draft, or have it pulled right out of their Social Security. But let's say somebody didn't sign up when they were supposed to, and they didn't have creditable coverage like from a job or VA. Well, they get charged a 1% penalty per month they went without coverage. and that penalty stays with them for life. Yep, like glitter on a greeting card. Now here's an update. There's a prescription payment plan. It lets folks spread their drug costs out monthly instead of paying all at once at the pharmacy, kind of like a payment plan for your meds. But tell them, if they don't pay, they can be removed from the payment plan even if they stay on the Part D plan. Extra help is just that, extra. Let's talk about extra help, also called LIS, which stands for Low Income Subsidy. Not let's ignore seniors like I once joked. If someone's low income and meets the resource limits, they may qualify for help paying their monthly premium, the deductible, their copays. In 2026, full LIS folks may only pay $160 to $510 for generics and $490 to $1265 for brand name drugs. And some people qualify automatically, like if they're on Medicaid or SSI. Others can apply at SSA.gov or the local Social Security office. Tell them it's worth it. Don't let pride or confusion get in the way of saving money, sugar,